Hi, welcome to the Pursuit of Truth. Just a quick one here. I was watching Sky News. They were talking about the NHS and mandatory vaccinations that may now be lifted because they're worried about the 70,000 who haven't been vaccinated. I don't know how many NHS workers, percent-wise, that works out. It's strange that so many people who work in the NHS who and I don't know whether these are the ones that work in critical care, but I mean, they're closer to COVID than anyone else and the aspects of it, and you would have thought they would be more likely to be vaccinated. I don't know if that means anything, but it is a little bit strange. But then I don't know in other work professions what percent, other people, that might not be a great percentage. So just because you see a big number doesn't always mean that's a vast majority. There might be like 10 million NHS workers, and therefore is a very small number that aren't getting vaccinated. But of course it's enough to make the government U-turn over this. But what I was interested in, this person that we're talking to is a consultant, and it's usually when they talk about people who are not getting vaccinated, you have a certain impression of these types of people that the media tries to create, and government and officials try to create them as anti-vaxxers and people with little education and etc. So it was quite refreshing to see someone who is working in the medical profession, who's a consultant, and this isn't on Joe Rogan's show, so it's not like you can sort of say, oh wow, he's picked out someone who's controversial. But on the Joe Rogan thing, I always thought of him as a bit of a shill and a flip-flopper who changes from week to week and is very much more of a government person than a conspirator, especially when he's interviewing people like Eddie Bravo. So I suspect this is all a big stunt, or because I see him as a shill, someone he's already come out and said he doesn't, he believes in vaccination. Anyway, that's not what I want to talk about. Just to clarify, I have been vaccinated, so just before you start thinking I'm an anti-vaxxer, I'm not interested in, it's your choice whether you get vaccinated or not. But what I was interested in is the argument that's been brought across from this consultant, suggesting that it is he, in his mind, a consultant who's working in a hospital, considering it still as an experimental drug. If you said that outside, if I said that it's an experimental drug, everyone would say, no, it's all been fully tested, blah, 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 you anti-vaxxer, you. So it's interesting that they managed to find someone, and I expect that we won't be seeing him again, and I'll be interested to see how long he keeps his job for, because any person that is respectable and comes out seriously against something, they tend to lose their job, or they tend to get rubbished, or find their way in a heat pile somewhere. So you can hear it and judge for yourself. I'm not trying to sway anyway. I know I'm cherry picking by bringing this to you, but it just interested me that it's unusual for the media to find someone respectful to make an argument. I don't know. It doesn't mean that the argument's true or not, but it's interesting that this actually managed to find its way on TV, and it does question a lot of the things that we're meant to believe about this vaccination, its safety and etc. And so here you go.
Here, Dr. Dropping this policy because, of course, Omicron is now the dominant variant, and when the policy was announced, it was Delta, which, of course, was more severe. But really, the key issue is these huge fears over what could be a massive staffing crisis for the NHS if this policy was to go ahead. There are thought to be 77,000 NHS workers who are still at risk of losing their jobs if this policy was to go ahead, obviously at a time where the health and social care sector is already under pressure.
Okay, thanks very much. Thanks a lot. So what happened was that the health secretary was telling us we all needed to be vaccinated. Everybody needed to be vaccinated. If you were working in care homes, or if you were working as a frontline health worker and you weren't vaccinated, as of the 1st of April for NHS workers, you were out. That was it. And then this happened.
What do you think of the new rule to require vaccination of all NHS staff?
I'm not happy about that. So.
You're not happy about it, tell me.
So I've had COVID at some point.
Yes.
I've got antibodies.
Yeah.
I've been working on COVID ITU since the beginning. I have not had a vaccination. I did not want to have a vaccination.
It looks as though he might not have to. Dr. Steve James is with us now. Hi, Dr. James. Thank you for joining us on the programme. Why did you feel it necessary to challenge the Health Secretary in that way?
It was an opportunity I think hundreds of thousands of people would have liked to have taken. It was simply there in front of me, and I chose to speak my mind.
Why do you not want to have a jab?
I never felt I would need to be vaccinated. I always thought that healthy people wouldn't have even been offered the vaccine. It was going to go for vulnerable people. I've never seen someone who's fit and well on intensive care. I know some people have had serious problems from COVID who've been otherwise well. And I assumed that it would be offered to adults, but never sort of given a message that everybody should take it, and certainly not for healthy children.
Is it not the social responsibility of healthy people to look after those who aren't?
I believe it's the social responsibility of healthy people to get natural immunity. I think it's historically much more likely to be long-lasting than a vaccine-induced immunity. And I think studies are bearing that out now.
But if they've contracted COVID, they could pass it on in that period of time that they potentially wouldn't have to the same extent if they had had a vaccination, is the suggestion from the NHS.
Well, it's a suggestion, and there's some data showing that with Delta, there was some reduction for a few months in the ability to transmit it. But you've got to remember one very key thing. Asymptomatic transmission is a idea that came from computer model generation. It's not real world data. So if you're sick and you stay away from other people, you won't transmit it.
What about if you don't know if you've got it?
Well, if you haven't got any symptoms, you're not transmitting it.
Okay, so you can't transmit COVID even though you don't have any symptoms, because again, that's not what we've been told.
If you're pre-symptomatic, so let me correct myself there. So if you're about to get symptoms but don't recognise it, that's possible. But in that tiny little window, we haven't got evidence showing that, at least not in a healthcare setting, that makes a difference. We know that in household contacts with Delta, recent immunisation reduces that. But we haven't compared people who were previously exposed versus those who weren't exposed to corona, who had vaccines, didn't have vaccines, and we certainly never tested it in a hospital setting.
But as you point out there, Doctor, quite often you don't know you've got it until you've done the test.
No, I didn't say that. I said that most of the time, when you have got symptoms, that's when you're transmitting, and when you haven't got symptoms, you're not transmitting, and there's a very small window where you're pre-symptomatic and go on. So if you don't go on to get symptoms and you tested positive, you're not transmitting it.
No, but you could have had, I don't know, a runny nose, whatever the symptoms were when you had Omicron, and certainly when it was the Delta variant. You don't know you've got it at that stage until you've done your lateral flow and then confirmed by your PCR test. So in that window, you can infect other people, including the elderly.
Yes, you can pass it on, but we know that with Omicron, it's very clear that doesn't happen, that the vaccine doesn't protect you from onward transmission. We also know that with Delta, the transmission was only reduced for a few months post-vaccine. And we also know that that's not comparing people who've got natural immunity versus people who hadn't got natural immunity and got the vaccination.
This is what the NHS say. Research has shown the vaccines help reduce your risk of getting seriously ill or dying from COVID-19, reduce your risk of catching or spreading COVID-19, and protect against COVID-19 variants.
Yes, that's correct. And that's based on the Delta information and comparing people who were vaccinated versus unvaccinated, not looking at people who've already got immunity. So that's not applicable enough data to the whole of the NHS staff, and it's not relevant to Omicron.
And you will not be having a COVID vaccination under any circumstances?
I will not be having a COVID vaccination, not unless the entire landscape of COVID and the vaccine changes. And, vaccine mandates are wrong.
Just to put it to you finally before I let you go, our resident GP said that you are being selfish.
Okay. I think 100,000 other people in the NHS think that we're speaking our mind because we do not want to be coerced into having a vaccine that's still in experimental trial stages, a vaccine that's got side effects that are not really clearly talked about at present, and people are concerned that they're higher than are being shared, a vaccine that isn't really very effective in stopping serious disease in the healthy population, because the healthy population doesn't get very serious disease from COVID.
But you acknowledge that it's saved a lot of lives, people being vaccinated, as opposed to where we would be if we hadn't gone down that route.
Absolutely acknowledge that it has saved lives of the elderly, the vulnerable, those who are immunocompromised, got severe comorbid disease. In that population, it has made a significant difference, together with the improved care in hospital and the other treatments that have been made available.
Good to talk to you, Doctor. Thank you so much for taking the time. Thank you.
Thank you.
So that was Dr. Stephen James. I want to read it out so you know. Consultant in Critical Care, King's College Hospital. Yeah, I wonder how long he'll be keeping his job. Be interesting to see whether they allow him to have his own view, which is against the government and most of the scientists. Of course, most of what he said was against the NHS, to do with the NHS mandate. So it might not necessarily be able to extrapolate that into the general public. But interesting, he sort of describes it almost like a bad flu that is, well, same like a flu, it's going to affect those people with comorbidity and people who have immune response suppressant problems and the elderly and those with critical problems, as opposed to healthy young people, which is what the government seem to be suggesting at the moment. Maybe this is just because of Omicron and the other ones were more severe. Anyway, I just thought it was interesting that someone had a different view who could actually string a sentence and was quite respectful, and it was interesting to see a different view on TV. Take care, take it easy, God bless the moose.